Welcome to the cystoscopy room at the Department of Urology at my hospital. The patient is now lying at his back on this bed here, and I will look into his or her urethra and urinary bladder. I will show you what it looks like inside a simulator, but the instrument we use is looking like this. It has a tip where we have the optics and we can look inside the body. We can bend the tip in different directions, as you can see right now. And so we can look inside the bladder in all corners of the bladder in order to find pathology and see what it looks like inside. Now I'll show you what it looks like.
We are now entering the urethra in a male. It's pretty long, as you can see. We're always looking for pathological conditions, and this is normal. This is what a normal urethra looks like. When we come to the end of this part, the long part of the urethra, we're looking at the external sphincter, the voluntary sphincter, which can be controlled by the patient. After having passed through the external sphincter, we are now entering the prostatic urethra. In the bottom you see the verumontanum where the ejaculate comes out at orgasm. Then we have the two lobes of the prostate compressing the urethra, so this patient might have problems urinating. The last thing you see, and this part we're looking at now, is the internal sphincter controlled by the autonomic nervous system. We're now entering the bladder. The bladder looks pretty large, and we have to go through all different areas in the bladder. We're now looking at the right and left urethral openings, which propulses urine from the upper urinary tract to the lower urinary tract. Inside the bladder we have to look through all different corners in order to look for pathological conditions and anatomical changes, in order to find the solution to the patient problems. In the top part of the bladder, there is always some air coming in with the fluids we're flushing in order to visualize as much as possible of the bladder. And when we have looked through all parts, we do it again when we back our instrument, and then we have finished up the procedure.